This is USNH Naples Hospital Hotspot with Lieutenants Kate Rooney and Kyle Brown. Brought to you from the atrium at US Naval Hospital, Naples, Italy.
Good morning. Today is Monday, March 3rd, 2014, and I'm Lieutenant Kate Rooney.
And I'm Lieutenant Kyle Brown. You're watching this week's edition of Hospital Hotspot, our bi-weekly news program that brings you the latest news, events, and features from USNH Naples. You'll notice that we have another warm body around the table with us. This is Mrs. Kim Brawley. She's our Patient Safety Officer at USNH Naples. She's joining us this morning in honor of the start of National Patient Safety Week, which runs from today through March 7th. Mrs. Brawley, thank you for joining us this morning.
Thank you very much for having me.
Now, we've got National Patient Safety Week. It's advertised right here, March 2nd through the 8th of this year.
Yes.
Can you just tell us a little bit about what is National Patient Safety Week and what is the theme this year?
Right. National Patient Safety Week. It's a national campaign for an awareness building on patient safety.
Okay.
And we do this at the local level. And this year it's Navigate Your Health Safely. And this is so that our providers and the healthcare team will ensure that the patients are included in their care, whether they come in for a routine appointment or are going in for surgery. Include them in their care at all steps.
Okay.
That's great. So one of the big focuses of Patient Safety Week is an emphasis on getting patients and families involved, obviously in their own care, and stressing the Speak Up initiative. Can you tell us a little bit more about that initiative specifically?
Right. Back in January, Vice Admiral Nathan gave a VTC to all the MTFs, Navy MTFs, and our big initiative now is patient safety culture. And with this, we want to ensure that every person, healthcare team member, will not be blamed or ostracized for speaking up when it comes to patient safety.
That's wonderful. And I understand that the Joint Commission, which is the accrediting body for healthcare organizations, the body that basically lets us run as a hospital, every year they come out with some national patient safety goals, and they've come out with their 2014 goals. I was hoping we could talk just a little bit about a few of those and sort of how they impact the patient care experience here at the hospital. So the first one that I wanted to touch on was patient identification. The Joint Commission's number one goal was correct identification of patients. So how can patients expect us to correctly identify them when they're here for a visit to the hospital?
Right, so patients, when they come in to pick up drugs from the pharmacy, whether they come in for a routine visit, that person at the desk should always ask you your full name and your date of birth. We no longer here at this command or any other MTFs deal with the last four of a social security number. It's too confusing, especially when you have 6 people in the family. You have
Right.
the same last name and the same last 4.
Right.
So from now on, it is full name and date of birth. And please, let the person fully identify you.
Great.
That's great. The next goal, because I'm a pharmacist, this one is really near and dear to my heart, is medication safety and using and administering medication safely. So what are some things that we can tell patients to do to help engage them and make sure that they're being proactive about getting medication safely?
Right. We have these little pamphlets, My Medications, and they are throughout the hospital. And we would encourage patients to write in here all of their medications, because you do see some of them do go out to the outside economy, and we want to make sure that their medications are compatible with what our doctors here will prescribe. Also, when the doctor does prescribe something, please make sure that you know what it's for, the strength that you need to take, and when it's needed, or is it every 8 hours? Make sure you know exactly when you leave this hospital that you have a full understanding of your medications.
And that's especially important too for the folks that are in the clinics that are seeing patients every day. Med reconciliation, that's part of the process where
Correct.
we're asking patients to verify what medication they're taking. And it's especially difficult if patients are coming from the States where they may have been in civilian care for several years and now they're coming back into the military system. We don't always have a good record of what medication they've been taking for the last years. So having a card like this is a great option for patients. I think it's very helpful for our clinic staff as well to ease that med reconciliation process that occurs. Now, I know one of the other goals, and a big one here at the hospital, is to improve staff communication. And the big key word with this is team steps. And so, like I said, a big push in the Navy and here locally at our hospital. What is team steps? What's the goal with that?
Team steps. It's better communication for better patient safety, bottom line. And on March 6th, Captain Palmer will have a safety stand down, and immediately following, we will have a Team Steps Essentials, where the entire hospital will be trained in Team Steps. In command orientation, it will no longer be a 30-minute presentation, it will be a 4 hours fundamentals program. So everyone at this facility will be versed in Team Steps.
And I know the big thing with Team Steps is making sure that everybody on the team, all the way from the surgeon or the pharmacist to the corpsmen that are helping you scrub in or counting the pills for you and checking your patients in at the window, feel empowered to speak up and to get involved in, throw up the red flag if something doesn't seem right.
Right, that's a big thing in Team Steps, is the speak up portion of it. So
it's particularly important in the military too for us, because
Yes.
rank gets involved and
Yes.
people can be a little scared to sometimes challenge someone who is more senior to them. But it's hugely important, and everybody in the healthcare team has an important role. So this is a very important one.
Absolutely.
All right, well, Mrs. Raleigh, thank you so much for joining us this
Thank you
morning.
very
This is
much.
really important information for our community to know about, so that they know that we are doing all that we can to deliver safe, quality care and help take care of their most precious loved ones.
Great.
So
Great.
thank you, and we'll look forward to celebrating the rest of Patient Safety Week with you.
thank you.
All right, and now let's get you informed with In the News and on the Calendar. Last weekend, staff from USNH Naples took part in a community relations project at the Old Mill Camp, not far from support site. 33 volunteers, including staff, family, and friends, cut, chopped, raked, cleared, pulled, hauled, and best of all, had a great time giving of their time and energy. The Old Mill Camp is run by the World Venture Mission Organization, and the event was organized by Chaplain Myhand of USNH Naples. Last week, our staff celebrated African American History Month with a high-energy presentation in the atrium. There were several guest speakers and performers on hand to help celebrate the themes of diversity and tolerance. The ceremony ended with a delicious potluck. Our dental staff was on hand at the Naples Area Elementary School last week in honor of Children's Dental Health Month. Our pediatric dentist, Dr. Eliza Roth, and several of our dental technicians spent time with teachers and students, stressing the importance of good brushing, flossing, and a healthy diet. Children's Dental Health Week ran from February 24th to the 28th. And for more on the event, you can check out the upcoming edition of the Panorama newspaper. That's in the news for this week. Lieutenant Rooney has on the calendar.
Thank you, Lieutenant Brown. As mentioned, the hospital will celebrate National Patient Safety Week starting today. The week will be marked by staff training that is specific to fostering an environment of patient safety. For more information on how you can take an active role in your care, visit the Medical Home Port Clinic. March is Colorectal Health Month. Are you over the age of 50 and unsure about what colorectal cancer screenings are available to you? To discuss your options, call Central Appointments and schedule a visit with your primary care provider. That's this week's on the calendar. In the hustle and bustle of everyday life, remembering to schedule your preventative care can be a real challenge, not to mention that the guidelines are frequently changing. Patients often ask themselves, when should I have my cholesterol checked, or how often do I need a Pap exam? For more on wellness exams and preventative care, let's go to Lieutenant Brown, who's standing by in the medical home. Lieutenant Brown?
Thank you, Lieutenant Rooney. Yes, I am here with Lieutenant J.G. Lakeisha Sells. She is a physician assistant in the medical home and one of our family practice providers here at the hospital. Thanks for joining us this morning on Hospital Hotspot.
Thank you for having me.
We wanted to get you on this morning to talk about wellness and preventative care. So we know a lot of time patients, they know, like, I should go to the doctor once a year, but they're not really familiar or acquainted with the preventative care tests that should happen at certain intervals. So we want to talk to you about some of those tests, the more frequent ones here today. And we want to start off with the test for women, because we know that preventative care testing differs, the recommendations between men and women.
That's right.
But we'll start off with one of the most common preventative tests, and that's a Pap exam to screen for cervical cancer.
Yes.
And I know the recommendations have changed recently, but what are the most recent guidelines for women who are getting Pap exams?
Okay, so the USPSTF guideline, which is the United States Preventive Service Task Force, recommend Pap smears beginning at the age of 21.
Okay.
And the screening should resume every 3 years.
Every 3 years.
Every 3 years. There are exceptions to that guideline, depending upon history of cervical dysplasia, and if you're immunocompetent, HIV.
Gotcha. So the general rule of thumb is every 3 years, but if you have something complicating in your medical history, your provider may recommend it more frequently. But for most women that have no history of abnormal Pap exams, the recommendation would be every 3 years for them.
That is correct.
Okay, wonderful. And along those same lines, that same population, screening for gonorrhea and chlamydia is now routine and recommended. What is the recommendation for that?
So recommendation is if they are sexually active up until the age of 24,
Okay.
there should be a yearly screening. So if they're on birth control, they should be tested for gonorrhea, chlamydia every year up until they're 24.
Okay, gotcha. And the second most common screening in women is probably for breast cancer. We know about mammograms. And again, the guidelines for mammograms have recently changed as well. So what is the latest? How often should we be doing mammograms?
So the latest, as far as, again, the USPSTF, is women should begin the screenings at the age of 50.
Okay.
Now, that has changed. It was 40, but they now are recommending 50 due to risk versus benefits of having the screening. Now, again, if you have some family history of breast cancer, then you want to start the screenings 10 years prior to the diagnosis of a first-degree relative. And that's something you can discuss with your clinical
Sure.
provider. We're able to deviate from the guideline, but again, that's a discussion we can have with the provider, and if need be, we can start the screenings earlier.
Okay, so the general rule of thumb right now, mammograms annually starting at the age of 50, unless you have certain other criteria that would require you to start sooner.
It's every 2 years.
Every
at 50.
2 years, starting at the age of 50. Okay, very good. And also for women, especially for older women, I know screening for osteoporosis, which is a brittling of the bones.
That is correct.
What is the recommendation for that?
So osteoporosis screenings, the recommendation is beginning at 65. However, again, depending upon family history or their history in terms of symptoms, that's something we can deviate as well.
Okay, and that's
And there's
with
a DEXA scan that
the
would
DEXA
be
scan.
performed. That
Okay.
is correct.
Now here's one for both men and women. How about for cholesterol screening? Looking to see if we've got high cholesterol. When should we start having that lab work done?
For women, the guideline is starting at 45.
Okay.
For men, it's beginning at 35. However, depending upon family history, symptoms, also just heart disease in general, hypertension, we may deviate from those guidelines.
Okay, but the recommendation should be for women starting at 45, men 10 years sooner at 35 for routine screening.
That is correct.
Okay, and then another one that affects both men and women is routine screening for colorectal cancer. So what is the recommendation for that?
Recommendation for the colonoscopy screening is beginning at age of 50.
Okay,
And once you have that screening, again, it's good for 10 years. However, there are some instances where a colonoscopy screening may be required prior to the age of 50, depending on symptoms, as well as family history. Again, if you have someone in your family, especially a first-degree relative, they were diagnosed, you may want to have the screening 10 years prior. That's the recommendation.
okay, and it's good for 10 years so long as you had a full colonoscopy.
Colonoscopy, that's correct.
Okay, because there are some other screening tools out there that may be available to patients, but to see if you'd be a candidate for any of those, like fecal occult blood testing, that would be a conversation with your provider to see if you meet that criteria. But those tests aren't good for quite as long as a full colonoscopy
That's
is.
correct. If you have a sigmoidoscopy, those are good for 5 years.
Okay.
And again, that's a discussion that you can have with the provider. There's a lot of hesitancy about having the colonoscopy, so
Sure.
we do our best, and we want, if we need to do a sigmoidoscopy as a starter, then that would be a test that we can perform.
Wonderful. And of course, March is Colon Health Month. It's coming up. So patients at home, they can expect to be receiving phone calls if they're due for their colonoscopy from us here at the hospital, encouraging you and helping you to set up those appointments. So, well, this is great information for the community. It does shed some light on what to expect when you come to a wellness visit with your provider, what sort of tests we're looking to do when. Of course, this isn't a comprehensive list. There's other labs that we do at set intervals as well. So, but I think the takeaway message is it's important to have a visit with your provider at least once a year. Leave the hard work up to us here to determine what it is you're due for, but it is a good idea to have some of these things in the back of your head as you're making appointments. So
Definitely, and we're happy to assist and provide all the education and guidance, and we look forward to you coming in and see us.
Wonderful. Well, thank you so much for joining us this morning again. This is great information. Lieutenant Rooney, back out to you in the atrium.
Thank you, Lieutenant Brown, for that great information and for the refresher course in preventative care. That's all for us today on Hospital Hotspot. Remember, you can follow us on our Facebook page, and we'll be back on March 17th for our next edition of Hospital Hotspot. Until then, for USNH Naples Public Affairs Office, I'm Lieutenant Kate Rooney, and we'll continue to lead the change to better health.